Hello, everyone, and welcome to another session of our Care Uncut series of live streams where we're trying to change the rhetoric and the understanding of social care. And of course, this one we are going to dedicate to deconstructing, if you like, the evidence that Matt Hancock, the previous Secretary of State for Health and Social Care, gave around lessons learned for the pandemic so far. A lot of contentious arguments about what was said, what was experienced, versus what actually happened from the government's point of view. And really all we want to do for this live stream is to invite some fantastic guests to discuss their experience of what has happened, lessons learned. And we've picked out a few bits and pieces from those the evidence that was given. I think it was something like 5 hours. We're obviously not going to deconstruct all of that within the hour that we have, but we're going to give it a good go. And we've got some really interesting themes. Of course, we're going to look at PPE. Of course, we're going to look at care homes and discharges, but also the future and what we want from the new Secretary of State for Health and Social Care, Sajid Javid, if I can say it, now. So really, it's just reconstructing that argument around what happened and also what was the lived experience of people who are involved in social care. So do stick around for the whole session if you can. Of course, if you have other things you need to be doing, you can watch it back on exactly this same link that you're watching it now. You can share it. You can like on Facebook and on YouTube. If you're watching it on Twitter, just hit that share button and get more people looking at the live stream and engaging with our conversations. So without further ado, I just want to give a little bit of a intro to some of the guests that we have on today. So we've got Belinda Schwehr, who we've had on before. Fantastic live streams we've had with Belinda talking about social care law, different aspects, and she gives a very honest account of how the law should be viewed and in contrast with how it is actually being implemented in practice. So very interesting views from Belinda. Brendan Martin, who we've had, of course, from the Buurtzorg idea that is being brought in and used in the UK, and that's part of what Brendan is involved with. Liz Jones, who's stepping in on behalf of the National Care Forum, representative of non-profit organisations who work in care. And of course, last but not least, Isaac Samuels, who again has been with us before and has had some of the most wonderful insights into what it is like to employ someone to support you who works in social care. And of course, he is also championing the voice of people in social care as well. So I'm so lucky to have a wonderful panel. And all I would ask you to do, if you are watching live, then shoot your questions or your comments. What is your first instinct? What is your first thoughts when you were watching clippets or news clippets, or maybe you watched the whole evidence that was given by Matt Hancock and specifically around social care? What did you think? What do you want us to talk about? Obviously, we've got our themes. We want to hear from you as well. We want to answer your questions. We want to share your comments. So do get involved. And of course, we're really excited to bring in our panel now. I'm just going to get them straight in one by one. There we go. So hello, everybody. Lovely to have you on. Thank you for joining me this evening. And I'm going to go straight in and allow you just a minute or so just to introduce yourselves and talk about your first thoughts on listening to the evidence that was given. So can I start off with Belinda? You're first on my screen.
Hi, everybody. I'm CEO of CASCAIDr, a charity that gives specialist legal advice basically to people who are struggling to get their full whack, as it were, out of the local authority under the Care Act. And COVID certainly hasn't helped that. My overwhelming feeling about the pandemic has been, why is it so impossible to get journalists and the news to treat social care with the same deference and respect and awe, as it were, that is given to the NHS? For me, it's the single biggest political issue of the age because it affects women, it affects equality, it affects the elderly, the economy, our happiness quotient, and of course, intergenerational security. So my experience is having tweeted madly from the 19th of March onwards through to, well, still currently, and feeling that I may just well be transmitting into an invisible ether because nobody picks up the issues that really seem to matter. And that is so depressing. I don't know what's happened to proper investigative journalism. That's my perception.
Really interesting. And to be honest with you, I think we talked about this before. We could have a whole live stream on the media. And of course, everyone will have different ideas and different thoughts on it, because some people, the bar was so low in terms of social care and representation in the media. Any little bit that we've got throughout the pandemic can just feel so amazing. But of course, like you say, especially from a legal perspective and people understanding their rights, there needs to be a lot more depth into that journalism. So thank you for that. Really interesting. Isaac, you're next on my screen. Can you give a bit of an intro?
So I think for personally, for me and for people that draw on care and support, we felt forgotten, and we felt that nothing really made sense in terms of the pandemic and the response to the pandemic. And there was a massive reality rhetoric gap. I think that we have had massive challenges for a very long time around the value of social care in the lives of people that need support. And I think the pandemic has created a space where, you know, there are more health and social care inequalities. The outcomes for certain groups of people were poorer. People were confused and left with very little choices around keeping themselves safe. And people tried their best to do the best they could with the information they got, but also managing, you know, long-term health conditions, and already challenged by, you know, lack of access to the internet in some cases, social workers not communicating with people. And it seemed that there was a very different approach all over the country. So there was no standard approach. Things like people being discharged with COVID into nursing homes, DP, direct payment recipients, never receiving any support from social care. In other places, there were uplifts of social care budgets. So there's a very mixed approach across the country.
Lots to unpick, so much. And of course, we'll come on to some of the positives as well, but hopefully we'll dig into some of the issues that you raised there as well. Thank you for that, Isaac. Brendan, can I come to you next, please?
Sure. Thanks, and thanks for having me. I'm Brendan Martin. I lead Buurtzorg Britain and Ireland, which is one of the international partners of Buurtzorg in the Netherlands. I'm not currently someone drawing on social care, nor closely related nor supporting somebody who is doing that. But what we do is we work with a number of organisations around Britain who are inspired by and want to be supported by the approach that Buurtzorg has taken in the Netherlands to transforming health and social care since its foundation 15 years ago. And in this conversation, I'm going to be drawing on, in part, the experience of Buurtzorg in the Netherlands about what's gone well and what's gone less well, because I think that that experience can inform quite well some of our discussions tonight and in general about the lessons of the pandemic, and drawing in part also on our own experience in Britain of working with a number of organizations where the people I'm speaking to mostly are the professionals, the primary process professionals, nurses, care workers and others, rather than the people they're supporting. So most of what I've learned has come through that route, but I think that's another important dimension of the conversation, another very important route to understanding what's been going on.
Absolutely, and just hearing those different varied voices are so important, bringing them into the conversation. Thanks for that, Brendan. And Liz.
Thanks, and hi everyone. Thank you for having us on. So I'm Liz Jones. I'm the Policy Director at the National Care Forum, and we are the voice of providers of care and support across the not-for-profit sector. So the observations that I'll be able to make this evening are informed really from the direct experience of supporting those organisations over the course of the pandemic. And I think there's a couple of things I'd like to say in terms of overall observations. I think for us, the way the pandemic has been approached, the way it's been covered, and the way it's been responded to has highlighted a relatively poor grasp of what social care can do and is on behalf of government and policymakers. And what we've seen really is how important care is to the lives of the people who are using it and the people who really need it to help make every day their best day. And I think the point that Belinda made about the focus on the NHS has really been felt quite strongly, really, across the sector. I think we saw that there was invisibility in the understanding of what care can do. And during the course of the pandemic, care homes have become a bit more visible, but the vast range of care and support services that help people in so many other ways still remain quite invisible. And I think that's been very evident in all of the policy approaches to testing, approaches to support, approaches to guidance. So I think that that's something that we've got a real opportunity to change. And I think, just taking Belinda's point about the media, we certainly made a conscious decision to try and improve our media profile on behalf of our members. So we felt we had some degree of success in raising some of the issues that people were experiencing through the pandemic. Sometimes we succeeded, sometimes we didn't, but I think we felt that we got a little bit more media profile on certain key issues than we would have ever had before. But we're quite a long way from the place we really like to be, where social care is front and centre of a deep understanding with government and the media.
We've got just a minute or so left on this in this section, and I just, since you've very kindly highlighted again the issue with the media, and the whole reason why I even started doing these live streams as part of co-produced care, and I was looking at our YouTube, we've got nearly 100, I think, videos we've done over the last 2 years, was to open up the debate, and we call it democratize the debate around social care, because we felt that it was quite binary, and also it just wasn't well informed. So I just want to come back to Belinda to really open up, if you could, in a short sentence, say what really is one of your main frustrations around the representation of social care. Because a lot of people would say, we knew nothing about it 18 months ago, and now we feel like we know a lot. So really, what's the problem? So what's your real issue with the way it's being represented?
I think that journalists and news broadcasters think of it as too difficult a subject to put into attractive, bite-sized chunks. And I think that unless there's a victim or blood and bruises to focus on, it isn't populist enough to talk about it at a cerebral level in terms of bringing out the nuance in the concept of a person's rights, not to get what they want, but to get what somebody else thinks that they need. And therefore, that whole debate is a closed book to people. And when then their lives hit a crisis, there's too much information of a poor quality on the internet for people to actually have any judgment about, because it's just a new topic to them. It's like me trying to learn about quantum physics, and it's just not attractive enough to sell newspapers or advertising slots. And that is fundamentally making it into a second class service and a second rate service, and something I think that we may well be seeing the end game for, because I think it may be government policy that in a libertarian way, families and the middle classes need to save money for their own social care. And what bothers me about that is that it will be mainly women who earn less than their partners who will be pivoted to step up for Britain, so that none of us have to pay more tax. And that, I think, is a fundamentally outrageous position for a pandemic to have put us in.
Absolutely. And we were talking in our last live stream to someone within the World Health Organization who's sort of head of this year of the health and social care worker, which they're promoting at the moment. Maybe not their fault, but it's not very widely known. But there's a report that they've done about social care and the gendered situation around it, and how it's led by men. Actually, the work is done by women or something like that. It was much pithier than that. But yeah, that's a whole different issue around the gendered issue of care as well. Just a couple of seconds on this. Liz, I feel like you want to come in.
Yeah, I mean, I think that interestingly, when you talk to journalists, I think some of what Belinda says about their understanding is quite right. So their experience of care often only happens when they've got an older relative who's becoming increasingly frail. So the breadth of everything that social care does is not really very visible to them. And so we can do something about that, I think, in how we portray, describe, demonstrate, show, make people aware. I think we can push on the breadth of what social care does. And just picking up on those workforce points, I mean, when we did some public polling last summer, and very interestingly, there was a very strong public recognition of the value of the care workforce, the paid care workforce. And 3/4 of the people we polled thought that care home staff and care workers did a brilliant job, and 80% thought that they should be paid better. So that idea that actually the government policy may be to withdraw from investment in a sector that actually can support millions of people and provide millions of jobs that just need to be better paid and supported. I think that there is a real opportunity to push that message, and the points that Belinda says about potentially a policy that's going to rely on the time and goodwill of families. I'm hoping that we're long past that, Belinda, and actually we can start to push for a reform that really brings proper investment.
Yeah, absolutely. And I think we'll come on to the future and what we can all do to try and push those ideas of investment in the right areas. Now that we have someone in a new person as Secretary of State for Health and Social Care. So I'm going to move on to the main theme of this, of course, is to look into more depth around the evidence given by Matt Hancock. And this was all arranged before we had the change in Minister, but of course, we still think it's useful to look through some of the issues because they're things that have happened and may happen again if we don't have a proper understanding of them. So I'm going to go on to people's ideas, their general thoughts around care home testing and discharge from hospital. So obviously there was this infamous saying of the protective ring that was thrown around social care. I'm guessing that all panelists have a different view on that. But, what was the reality last year? In a quick sort of minute or so, if you can. And I'm actually going to change it up for our plan. I'm going to go to you, Isaac, first, and your experience and your thoughts on obviously the comments of a protective ring.
I think it's hard for people to hear. It's painful because many people's experience has been that at the beginning there was very few plans that made sense and people didn't know what to do and they made it up as they went along. And then when some of the plans came in, they were so restrictive, they really didn't enable people to have the kind of dignity, particularly those that were at the end of their life as a result of COVID. I think people just totally felt let down. And, it took a lot of seeking information, advice and guidance. And some of us were able to do that. Most people weren't, to be able to navigate all the mixed messages. It was really, heartbreaking. And I think people just feel so let down by it.
Thanks for that, Isaac. Brendan, from your point of view as well, what are your sort of initial thoughts? Reflection from last year. I'm going to need you to unmute, Brendan. Sorry, I can't do it at my end.
Sorry, yeah. Thanks. I'll try to improve on that matter, but I've been trying to improve on it for about 18 months now. What strikes me about it is that the prevailing assumption at national government level was we know best. And that raises so many issues of where knowledge and understanding really lie, which is often with the people who are drawing on support, who need also to draw upon sometimes professional advice as well, and the professional qualifications and experience of the professionals that they're drawing upon. It's important for that expertise to be at the available to the people drawing upon support. Sometimes the expertise about things like testing and tracing was there in local government professionals, but this was not drawn upon. So a consistent message, a consistent failing was a government trying to do things as if they knew best, when actually there's a hell of a lot of knowledge out there dispersed amongst people who draw on care, amongst people who provide care, amongst the organizations that employ those people, and so on. That doesn't mean to say that nothing needs to be centralized. Many times the wrong things are actually being decentralized, and responsibility for the wrong things are being left with those who are unable to meet those to meet those responsibilities. So PPE, for example, is a good example. You know, that was crying out for bulk buying at a central level, but immobilizing local distribution networks to get the stuff to where it was needed, when it was needed, in an efficient way. So this clearly we need a much more developed understanding about where authority and resources need to be, and to align those with where the knowledge is and where the understanding is and where people are most affected, and to have government really responsive and listening to those needs and responding to them in an effective and timely way. And of course, what in general we had was rather the opposite of that. And I hope that that's one of the key lessons that we can learn, not just politically, but also as a society, and about how we organise in general.
Yes, organising, really important point. And on the point of organising, we do want to hold a live stream with unions and how they can support the sector. But sticking on this issue of discharge from hospital, I think my good friend in the background studio has a video on the theme of discharge. I think we'll play that, and then I'll come to Belinda and Liz for some comments.
The care home providers are very clear. We all know that there was limited testing in care homes. Yeah. So to attribute the deaths, the positive cases in care homes to hospital discharges without a representative study can't have the weight that you're placing on it. We don't know, and it's important that we do find that out. No?
Right. So, Belinda, that was the short clip. It's taken a bit out of, you could watch a lot more to get the proper context around that. But what on that point, Matt Hancock was trying to say was actually it wasn't to do with people coming out of hospital that was causing increased death rate in care homes. It was more to do with the fact that there's community transmission, and he was relying on some data from the ONS, I think I'm right in saying. But what the co-chair was trying to point out was the ONS data isn't a reliable source of data to rely on, because of course we weren't testing at the time, so we wouldn't have known anyway whether the deaths caused in care homes were from community transmission or from hospital, because there was no testing to prove that at that time. So there's an issue around what data the government is using to prop up its arguments in certain ways, but I'm more interested around the issues of discharge, which you have talked about before, Belinda.
Yes, my feeling when I look back at what was enraging us and what we were tweeting about was that there was a positive policy not to test. because the hospital discharge guidance issued on the 19th of March basically directed local authorities and the NHS to get people out of hospital, regardless of the WHO guidance and the recommendation that people be tested negative twice with a 24-hour gap in the middle. The hospital discharge guidance was a completely different discharge to assess policy that was just kind of made up to fit COVID from what had already been in place about discharge to assess. And when you think about the way the guidance basically told care homes that they must take people, I think what that brought out for me was that people don't understand, because they don't understand the sector, they don't understand that government doesn't control care homes. And government doesn't control local authorities either. But when you think about who runs care homes, they're very good people, but they actually know very little indeed in legal terms about what a duty of care might require in a pandemic. And they particularly don't know much about human rights. So they are concerned, of course, about their residents and their staff dying on their premises. But the reality is that they have to dance to the tune of their corporate owners or their shareholders, dance to the tune of their council or CCG commissioners, dance to the tune of CQC, and dance to the tune of their insurers. So from my perspective, it was obvious that they wouldn't have a chance of competing with a national supply machine that was going on a procurement jamboree. And the idea that any of that, when you were having stuff about clinical frailty scoring being talked about by the medical profession, DNARs being foisted on people by GPs over the telephone to nursing home managers, stuff about the whole question of the WHO guidance just not being picked up by anybody, and the issue about who was even supposed to be buying the PPE in terms of even if you knew where to get it. All of that, to my mind, is the antithesis of that hashtag, whatever it takes. So it makes my blood boil to think of the Department of Health and Social Care even now finding 50 ways not to answer a straight question.
Well, yeah, a very impassioned answer. And from a legal perspective, I know that you've trained a lot of people, so you feel like you have insight into how people can not quite get to grips with so much of the legislation. And of course, there was so much coming at us at that point. Then you had the human rights perspective. But Liz, can I come to you? Obviously working with a lot of care providers, and there is the point on there are just so many different stakeholders, whether you're for profit or not for profit, you still have the CCGs and the NHS hospitals. And I felt like in that clip, there was almost a little bit of gaslighting, almost to say that the deaths weren't caused by people coming into care homes. It was the community transmission. But then I know I've heard from managers who say that we were fine with our cases, but for the fact that we had someone that came in who wasn't tested, or we felt pressurized. What was your experience? What were you hearing from managers at the time?
Yeah, so let's deconstruct some of this a bit. So the data that Matt Hancock was referring to was a report produced by Public Health England relatively recently in response to a demand from the Public Accounts Committee that they try to put some sort of sense of scale on the numbers of cases of COVID that were seeded into care homes from hospital discharge. And the report from Public Health England is woeful, actually. It suggested that 1.6% of outbreaks in care homes were seeded from hospital, and it was based entirely on the picture of data they could get relating to people who went from hospital into care homes who'd had a test. And as you all know, there was no testing of people leaving hospital. The guidance in March, the policy, the letter that went out to everybody in the NHS on the 17th of March, and the subsequent guidance, the hospital discharge guidance that Belinda referred to on the 19th specifically said that the priority of people in hospitals was to get people out of hospitals to free up beds for the NHS. And wherever those people went, whether it was into care homes or back to their own homes, there was no requirement to test them. Now, I'd like to push back a bit on Belinda's suggestion that there wasn't challenge on this. There absolutely was challenge on this. There was challenge from sector representatives like ourselves. There was challenge from individual care homes. I can only speak for the not-for-profit sector. They are not dancing to the tune of their shareholders. They are driven by their mission and their values, very often their charitable mission and values. And they tried incredibly hard to stand firm against this policy. We wrote guidance for them on how to resist. We took a whole range of calls about how to support managers and senior managers to insist that they knew the COVID status of people coming out of hospital. And I think that it is not possible, actually, for the government to point to any credible evidence about the level of cases that were caused by discharge from hospital, because all of the things that you would need to have in place to demonstrate that that wasn't happening, those things were not there. So that I don't think it's possible for any Secretary of State to make a statement that said, actually, we don't think that discharging people who may have had COVID into the most vulnerable settings, we don't think that that's valid. And we think it's all down to community transmission and staff being the vectors of that transmission. So I think today, actually, the Public Accounts Committee were taking some more evidence about this, and they were really clear that no credible weight could be attached to that report from Public Health England. And that it's very clear from the experience of providers in the sector that policy, and it comes back to the points we discussed earlier, that policy was all about prioritising the NHS. And at that time, that was at the expense of social care. So testing was prioritised in the NHS, discharge was prioritised for the NHS, access to testing, even if you actually had somebody who was symptomatic in your care home, only a couple of people were tested to establish it was an outbreak, and then no further testing was there. So it comes back to taking responsibility. I think it's very important that the government does take responsibility for when it's made policy mistakes, and that was clearly a policy mistake. And the idea that there was a protective ring around care homes, I don't think that is a credible thing, really. It was something we called for throughout March and April on behalf of our members, as we could see the devastating impact that COVID was having and the enormous lack of support coming into the sector to help us respond. And I think it would be beholden upon the government to recognise that those mistakes were very serious at the beginning. They've taken steps to rectify them since, but they were very serious. And suggesting with some rather dodgy data that discharge from hospital did not play a key part, I think is not right.
Thank you, Liz. That was really helpful. And thank you for correcting me. It was PHE and not ONS. And it's really important to get that right. And this is great. We're having debate. We're having discussion. We're having different point of views. So absolutely love it. And if you're watching and you're enjoying it too, please do give us a thumbs up. If you want to hear more about something that's being discussed, or we want us to touch on something else, or just have another comment, then please do share as much as you can. I want to move on to PPE very briefly, because I know time is tight. So can we play a clip on from the evidence that Matt Hancock gave to the Select Committee? And then I think I'm going to come to you, Isaac, about your experience on PPE and what you've heard from other people in your network, and maybe to respond to some of the comments. So Tobias, can we have that clip, please?
Did you ever say or brief that the shortages, such as they were the fault of Simon Stevens, the fault of the Chancellor of the Exchequer? It's not my fault. they blocked approvals. That's what Mr. Cummings told the committee. Is that true?
No, that is not a fair recollection of the situation. Now, getting hold of PPE was always a huge challenge. And as the National Audit Office have shown in their report into this, when they went through all of the details, there was never a point at which NHS providers couldn't get access to PPE. But there were huge challenges. We first opened the stockpile of PPE that we had in the event of a pandemic. We opened that in January. We started buying new PPE in February. In March, China brought in export restrictions. And you'll remember at the time that there was a huge global demand for PPE. There were aeroplanes that were being turned around mid-flight. The European Union put out demands for PPE, calls for PPE that went entirely unanswered. We had to remove a piece of bureaucracy that was in the way that put a limit on the price that could be paid for PPE. And we took a policy decision that we should pay at the top of the market. That did require the Treasury to make that change. The Chancellor was incredibly helpful in driving that through, and we managed to get to this position where, despite local challenges, and I don't deny at all there were challenges in individual areas, there was never a national shortage of PPE because of the action that we took.
Thank you.
There was never a shortage of PPE because of the action that we took. There was a lot in that clip, to be fair. But I will come round on that because I know you all have some views. But Isaac, can I come to you first on your first thoughts and experiences?
My blood just boils. I'm so angry inside because regardless of having lots of PPE, it was not getting to the people that it needed to get to. So for myself, we weren't able to buy PPE via Amazon, all those kind of things, because stocks had run out or were just a long way in the future. We couldn't access the resilience forums because we weren't recognised as part of social care for those that direct their own care in their own homes. Care homes were, the increased cost. So there was just so much confusion. People didn't know where to get PPE, let alone how to use it. And the previous segment also made my blood boil because of, we talk about this protective ring around people and we talk about doing right by people, but actually not only did people in care homes die, staff died. Not only did people were not able to get PPE, there was more bureaucracy added to the process. People didn't know where to go. When they were given information, it was that nobody answered the phone, or they were told that they're in shielding, got to stay at home for 12 weeks, told that they have to come to a centre to collect PPE. None of it made any sense. There were so many missed opportunities. To say that the PP was available, I have no understanding if there was lots of PP, but it definitely didn't get to most of the people that I know. It wasn't distributed in a way that made sense. People were reaching out, connecting, and the way that people like myself managed to get PPE was asking on social media, and we had kind people, sending gloves, and so there was this real community response, but nothing from the local authority, nothing from the resilience forums, and lots of information, but very few actions that came to actual tangible PP in people's hands. And that did change towards the end of it, but people needed it at the beginning, and as a result, many people probably became positive with COVID.
Yeah, and it's really disheartening to hear that clip, but I almost feel like it is a very political one because at the end it was almost to say the shortages weren't because of us. There's nothing that we could have done differently to have prevented it, but I think there's some real learning to be done from that, and obviously we're still in it. People are still struggling. We've got a new wave coming along. It's going to affect people in different ways. Long COVID is going to create more people who need to draw from social care in the future. And really, I wonder whether the point that you made, Isaac, about the community, and actually that really people reaching out because the centralized systems weren't geared up, they weren't organised properly, they weren't prepared for what came. And I know that, Brendan, the model that you're using with the Buurtzorg is quite different from traditional models. Do you feel that maybe we need to, in kind of lessons learnt way, move away from centralised, sort of, for example, using PPE systems, or that we just need to be better prepared?
Well, I think, I'll give you the example, a very useful experience, I think, from the Netherlands. When it became clear in the Netherlands that there was going to be a pandemic, what the Buurtzorg leadership did was to put in place, strengthen what was already in place, a very effective way to learn and respond, to get intelligence from the people at the front line, the professionals at the front line, and the people that they were supporting, about what they needed, and to put in place a crisis team very quickly at the back office to start to bring together epidemiological expertise and other areas of expertise that were able not to tell our self-managed teams at local level what to do and how to respond to local needs, which varied, but to support them and be highly responsive to what they needed. And one of the things that involved was quickly making an international order for PPE. And Buurtzorg managed to get hold of enough PPE, not only for its own needs through the pandemic, but actually to be able to set up a warehouse that was able to supply other care providers as well if they were running short of it. Now, it seems to me if an organization like Buurtzorg can do that, government can also do that. But so I think it's not a question of either centralizing or not. The actual purchase of the PPE, in Buurtzorg's case, it did make sense to centralize that. And for all I know, it makes sense to do that if you've got a competent government as well. That's a very big if, obviously, with the adjective competent. But that government and or organization in turn needs to be really responsive, really listening to, really have networked connections with the people who really know what is needed, and in their local areas and in their own homes and in care homes. So it's that nature of the relationship between the centre and the people on the ground who actually know. That's where the problem is, I think. And I worry sometimes that if we, of course we have to hold government to account. That's absolutely important. I agree with all that Liz was saying about that. But at the same time, I think we have to be realistic about what we can expect from government. And one of the things that worries me a bit about the campaign at the moment about government said, Johnson said he would fix social care. We must hold him to his promise to fix social care. Actually, government can't fix social care. What we all need to do as a society is fix social care. And I think understand what that means we need from government and what that means we need from local government as well, which isn't for the government centrally to be telling us all what to do.
Very interesting. So government can't fix social care. I'm going to come to Belinda in a second for your views on that, Belinda. But I first want to come to Liz, and I'm hoping for some good news because Brendan brought up some really interesting issues about listening and being heard and interacting with the right people. And I know that lots of people across your organisation have been tirelessly trying to work with government, trying to help correct any guidance that's not quite right, trying to get the voice of your members there, in part of different advisory groups. I know Vic Rain has done a lot, but I know your organisation has got lots of people who are, including yourself, who are working at that level. Do you feel that we're in a different situation than we were in terms of the government listening and having an ear of someone who can actually make those changes now? And can we be hopeful that actually going forward with maybe a new person as Secretary of State, that we can have those voices like people who draw from social care and people who run care services and so on, being heard and represented in new policy?
I think there's everything to play for. So I think, I mean, the experience, just thinking about PPE, you know, there was a real challenge, and part of that challenge goes back to prioritising the NHS and making it very difficult for anybody else to access those sorts of things. So there is definitely a role in some of this for an efficient, centralised procurement system that can then deliver out to wherever these sorts of things are needed. And what the government has finally got in place in terms of PPE is working relatively well. It just took quite a long time to get there, and it benefited from some of the things that governments can bring in terms of scale, and in terms of the ability to provide not just access to these things, but kind of confidence and resilience in that sort of supply chain. So that came eventually, but it didn't come for quite some time. And the other thing that was a really good example of how not to do things was the change in the guidance about how you use PPE, how you use infection prevention control. And that the reason that was so confusing is because for quite a long time, the guidance was being written by people who didn't understand what social care might need. So I think there has been some learning about how important it is to have the voice of people who use care and people who provide care at the table. I guess you will always come up against certain things that are not likely to change in terms of which I guess are some of the political aspects of this. You know, if you have a firm political view on what you think is the most effective way to achieve something, then all the co-production in the world is not likely to change that view. However, you know, we have got a new Secretary of State. He's had a role previously in Treasury. He's had a role previously leading MHCLG, hasn't he? So it's the kind of the three bits of the triangle are there. And I think that there is an opportunity for us to work with a slightly reframed mindset. And I slightly disagree with Brendan in the sense that government can fix some aspects of what we need to fix to help us improve what social care does and what it can do in the future. And that comes back to the investment argument. You know, there are two key reasons why we should invest. One is because it will make such a difference to the people who need to use care now and in the future, care and support. And it will make such a difference to the people who work in it. And remember, all of those people who work in social care do things like pay their taxes, spend their money locally. Care is a very local business, and it does bring both economic benefit and social value. So let's start thinking about what social care does, is, and could be in those conversations. I think that there is an opportunity to get that message through. And I mean, just listening to Isaac and some of his colleagues who've been supporting us in some discussions around this, you know, what you see from a system that it doesn't listen and has other people making decisions for you is that those decisions are bad and the money is wasted. Actually, if we work together, treat people who are using care and support, which may be us or is very likely to be us in future, then that equality and that respect will help us create something better. And I think that there are some aspects of government that will listen to that. And so our job on behalf of our members certainly is to keep pushing at that door and say it will be better if you talk with us, do it with us, listen to us and respect us. It will all be better.
Thank you. Bit of positivity there. Appreciate it. So we're going to come to you, Belinda, on that issue of what can government do versus what should we be expected to do ourselves, I suppose, and your comments on some of the things that have been said and what we should be looking for, that sort of last theme around the future, because I know you have to kind of get off bang on half past.
Thanks,
so
yes.
I'll let you start that section off for us.
Well, picking up on something that Liz said, I thought was interesting in terms of what government can fix and what government can't fix. I don't know whether people realise this, but there is actually no real core of policy civil servants in the Department of Health and Social Care. The Ministry of Housing, Communities, Local Government and the Treasury really run social care because it's a local government function and the Treasury controls the money supply. Before the pandemic, I remember writing to the Department of Health and saying, would you like me to put all of the legal references back in the care and support guidance so that members of the public have more of an idea about why the wording is as ambiguous as it is sometimes? And I was told, to my astonishment, that there is no policy lead in the Department of Health and Social Care, and that the head of it was actually a GP. And I think that says it all. When it actually comes to the whole PPE thing, if you look up the National Audit Office report from last November, it says, and it finds as a fact, that there was desperate customers competing against each other, pushing up prices and buying huge volumes of PPE, often from suppliers that were new to the PPE market. And the guidelines all was changing as to who had to wear what. And in terms of Isaac's interests, the guidance to local authorities about the fact that they had to provide for direct payment clients to have the money to buy PPE because it was an obligation of an employer to keep their staff safe. That didn't come out till well halfway through the summer. All of that added to the confusion. So I think that what I'm interested in since then has been the litigation. There's an organisation called the Good Law Project that has brought case after case against central government in relation to the lack of transparency and the apparent bias, and people will have heard of this, the VIP lane. And reading some of that makes you ashamed to be British. It makes you think that we live in an absolutely corrupt and rotten state. And there's I think there's something like 4.2 billion's worth of contracts that the government has had to quietly publish details about this last month as a result of those cases. So I know we don't have time to go into that, but I would really recommend that people do look that stuff up in order to have an informed opinion. As for what we could expect from Sajid Javid, I understand that he has a reputation for actually caring about the obligations of the functions that he's been put in charge of, and therefore is interested and good at actually getting them funded. But he also has a reputation for being a libertarian, and he follows Ayn Rand, the author, as one of his favourite authors, which lots of us did at the age of 20, but maybe not at the age of 60, when we've come across the fact in our lives that there are people in society who just can't be left to drag themselves up by their own bootstraps because of disabilities and chronic illness. And that's what makes people get more compassionate as they get older and think that we do need a social care safety net. So I can't be sure which direction we'll go in. And I think the jury is out about that, particularly because of integration of the NHS and social care. From a legal perspective, duties to social services clients are mandatory, they're enforceable, and they have to be delivered, even if the social services team has run out of money. Whereas the duties under the NHS are inchoate and unenforceable and not mandatory. And ultimately, I think that if social care gets subsumed into the NHS, it may work better at a practical level, but the idea that anybody has got a right to have their needs met will go out the window forever. And that's really, I think, why it is such a serious issue and why journalism needs to be making it a matter of public debate.
Absolutely. Thank you. That's a really good way to round that bit off. I've got a very quick question. In terms of what we can do, so things like the Health and Care Bill is making its way through Parliament. Is there any use in us contacting our MPs and letting them know our thoughts on that bill as they are invited to give comments?
If you're asking me, I don't know. My MP is Jeremy Hunt, and when he was in charge of social care, he was one of the biggest perpetrators of austerity being an ideological necessity. And if COVID has proved one thing, it was that the money was always there. And I think that it's brought it home that it is a political issue, that the personal is political, that lots of people would be prepared to pay more tax just for the idea that there will be social care. But I just can't say, because I have lost faith in the political process and in the administrative system that we run under. I just have lost any faith in people having regard for the rule of law. And that's a terrible thing for a public lawyer to be saying after 25 years of dreaming that it could be done better and it could be done more lawfully.
Yeah, I'm going to thank you so much for that, Belinda. And do feel free if you need to drop out. I'm going to come to the rest of the panelists for their last comments. But thank you so much for joining us. And Brendan, I will come to you in a second. But before I come to you, can I just draw on your thoughts, Isaac, and what your hopes are going forward, and for the new Secretary of State, and what asks you might be putting forward as a necessity going forward now?
So people like me and people like my colleague Sally, who is a carer, we can't lose hope. We need social care. It enables us to have the lives that are so important and needed. We are valuable in this society. We deserve a life with purpose, and social care as a sector is really valuable on so many levels. And we need to not only invest in social care and the workforce, but we really need to create the space where we listen to people. People know what's best for them. They're part of that solution. And just on a purely business case, you know, we know what works for us. So trust us, support us to be part of that solution. And don't forget, we're always there to help. Those with lived experience, those with learned experience, you know, people coming together and collaborating makes such a difference. And we deserve a society that really values all of our members, regardless of the barriers that they may face. And some of us face multiple barriers, but actually it's about giving space and opportunity to just have those really ordinary experiences.
That's really good and really strong and well said, as someone has put in the comments. And yeah, I love that. Trust us. At the beginning of the pandemic, I just remember so many people just wanting to say, this is how we think this certain policy or this change should happen, because we're experiencing it right here, right now, and just wanting to help and wanting to give the advice. And the idea of just, you know, we're here to help. We want this to work because it involves us. We either work in or draw on care services, or have lived experience, like you say. So yeah, excellently said. Thank you so much for that, Isaac. And Brendan, can I come to you next for your thoughts on the way forward?
Yeah, sure. I'll be as brief as I can. I think that at the beginning of this discussion, there was a fear was expressed quite rightly that if we leave care to families and then that will fall back very unequally on women, and some people will have good care, some people will have poorer care, even worse than we've got now. But on the other hand, I think we also need to think about what assets and strengths are there in communities which can be mobilized to support people, and so that we support each other. I suppose the way I look at it is, I'd like to think of social care going forward less as a sector and more as a way in which we organize ourselves as a society. I remember when I was looking after my mum, and it was that experience that really brought me into, as with many others, into thinking more about and more thoughtfully about social care. It wasn't that I didn't want to provide any support to my mum. I did. I wanted to give lots of support to my mum. And I didn't particularly want professional carers doing things that I could do and that she preferred me to do. But I did want them to give me the supports I needed to do those things. And I did want them to do things that either she didn't want me to do or that I was unable to do. So I think it's all in the relationships between people who provide care and people who draw upon care, and getting those relationships right. And they have to be based, as Isaac was saying, on really understanding what people need. Start with the needs of people needing support. Think about what they can do if they are well supported to do it. Think about how to build on strengths rather than on deficits. And think about the professional role in that context. And I think that for all sorts of reasons, not least if we want our society to be a caring society, I think that's how we have to start looking at social care, rather than either seeing it as a responsibility for individuals or a responsibility for their families, i.e. women, or as a responsibility for the state or for the market. It seems to me that it's a responsibility of us all, and we need to think about the relationships between government, organizations, professionals, and the people drawing on support and the people around them. That's where I think the creative thinking needs to be. And I think we have an opportunity with the Health and Care Bill. The government is, on the one hand, promising to decentralize, and on the other hand, threatening to centralize. Well, I think that creates a space for a conversation of the type that we need to have. And I think we have to use that space.
Yes, I agree with so much of what you said, and thank you for sharing your personal experience. I think a lot of people will be able to relate to that, and bringing it round to how we all need to think about those relationships. Really good. And I think, you are right. Sometimes I do look at these bills and regulations, whether it's to do with vaccination or the Health and Care Bill, and you just think there's just so much not quite right with it, but use it as an opportunity. And I feel that Liz, in your organisation, you're absolutely using the opportunity where you can to try and speak to the right people to get the change that your members see that's really needed. So what are you going to be asking for the, well, you probably just carry on doing what you're doing anyway, but what are your hopes going forward for the new Secretary of State?
So I think there is an opportunity with the Health and Care Bill. I think that people should get involved. I think people should be interested. On the face of it, it can look like just another reorganisation of the deck chairs across the world of health, and we've had plenty of those, and you may think they haven't made any difference. However, there are some fundamental things in this bit of legislation which could ensure, if we can shift them a bit, that the voice of people who are using care and support services and people who provide them are at the tables making those decisions. And if we don't do something, there won't be anything in the legislation that makes it so. So there is an opportunity to say, I'm bothered, I'm interested, I want a voice for people like me, whether I use care now, whether I might use care in the future, whether I've been battling to access some care and support, or whether I just I feel very strongly that actually in my local area, people who are going to be affected by decision-making bodies called these integrated care systems or integrated care partnerships, I feel very strongly that they have the right people around the table. So if there is one thing you could do, that is to talk to your MP and to make a fuss about how the voice of people like you and people who are important to you are going to be at that table. And we need to do it now. The bill is going into its second reading. It will go into committee stage. I think Brendan said, it centralises on one hand and devolves on another. There is such the NHS is a very hierarchical setup, and actually there's something about helping your local area to reclaim some of that power and that decision making, and think about investing its money in the places that are going to make the most difference to the most people. But if the people aren't in the room to have that debate, then you're never going to have that debate. You're going to have the same discussion that you would have now, because if those people just move from where they're working into a new system that's got a new name, then the thinking won't change. It's about the opportunity to change the thinking, and actually some prescription from government about who needs to be around the table is not a bad thing. Not how that works, but making sure those voices are there. That's the opportunity in the legislation between now and whenever it gets passed later this year. So I would say take an interest, do worry about it, ask your MP what they're going to do about it, and see how they think your voice might be heard in your local area.
So it's almost mandating co-production or making sure that people have their voices heard. So that top down, but from the top, it's asking, but the bottom or everybody else
Yes, absolutely.
is comes up, so we're flattening it out. So yeah, no, that was really good, and I'm glad that you thought it was a good idea. We do get in touch with our MPs, because I swear we just do not use them enough, and that is literally what they have been elected to do, and that's to represent the people in their area. So email, message, anything, just you can contact them by email, and it's in their inbox. They have to respond to it. They have to be there and do constituency work. So absolutely get involved. And we did have a live stream on the health and care bill. So if you're people have signed up on YouTube, or YouTube is the best place to get it, and you'll see all our different videos. You can find it and get a bit more information on it. And of course, we'll have some links as well. We'll put in the description of this video on it. So we've gone over time, which I kind of expected, but I think we've done pretty good, actually. We've gone through quite a lot. And I just want to say thank you so much to my guests. You're all such wonderful people, and I love everything that you do, all your organizations that you work for, and the way that you support social care. So thank you for taking your time out, your evening, to be with me tonight. And I think it's just the luck of the draw that I didn't actually book this in for last night, because we normally have our live streams on a Wednesday, because we would really have struggled. So we'll be committed. But anyway, thank you all so very much. Take care, and I'll let Tobias take you out of the live stream now. Bye, everybody. And if you're watching, do stay for a couple more minutes, because I will let you know a little bit about what we are trying to promote. So I'm still just in awe of everything I've been listening to. I have to get back onto it. So a couple of things. Obviously, we talked about the health and care bill enough now, so I won't go over that anymore. The other thing that's coming through is that you might need to pay attention to. We talk about this all the time. It's nothing new. Of course, is vaccines being mandatory within care homes. And there's a really interesting blog that has been done by James Sage, who I don't think we've had on a live stream before. Correct me if we have, because I've done so many, but I have talked to him a lot on different calls, and he's from Solicitors Roysworthy King, and he does a lot around employment law, and it's a really interesting blog around what you need to expect, how you need to prepare your teams now for making that mandatory. He makes some really interesting points around this, and it's to do with making sure that the exemptions for vaccination in care homes, there aren't really that many. So even if you are pregnant or breastfeeding, for example, then that's not an exemption. But there are sort of certain medical exemptions. So he talks about that, how to prepare your staff team as well for that change, what you have to do, the discussions as somebody who employs people, that you need discussions you need to have with your staff around how you're going to deploy them if they aren't going, that's their the legal language, you know, how you're going to employ them really, if they're not willing to take the vaccine. And of course, if you've got a couple of people who are just not too sure about it, of course, we did a live stream around myth busting on vaccination back in February. I know a lot has come on since then, but it's a really diverse panel, and we've had some great feedback. I think nearly, or maybe just over 1,000 views. So do log on to that, have a look, see if it's useful, share it with somebody who's not too sure about it. The more people, obviously, that take the vaccine, the easier it is for people working in care homes. But obviously it's everyone's individual choice. And I think that's pretty much the main things that we wanted to draw people's attention to. And thank you very much for joining us this evening. I hope you found it very interesting. Like it, share it. This same link you're watching on it now, you can watch it back at any point, just rewind it. And of course, we just want to get those conversations going. And if you subscribe to our YouTube channel, or if you're on Facebook, if you like our page, then you'll find out when our next live streams are, because we aren't doing them as regularly, but we are organizing them. One that we're organizing is obviously around the gender issue and what we can do. to support or discuss that in a bit more depth. We also are looking at the organising and unions. So we're trying to get a few union representatives from the big unions to come on and have a discussion. What can they do for care workers? Is it worth people paying to be part of a union or not? And how can they support the sector in general? So that's something we really want to get involved with, and there'll be others coming up as well. We're going to slow down probably in August, but then we're hoping to do a conference as well in September. So do subscribe and get involved, and of course follow us on Twitter, and we look forward to seeing you again very soon. Thanks everyone. Bye bye.